Hi guys, I am back with my week 5 results and they're quite interesting. So in week 5, I've lost 3.6 pounds or 0.7 points on the BMI. My BMI actually just got out of the obese range, so I'm at 29.9. Congratulations to me. The total weight loss for the 5 weeks has been 10.2 pounds. Now let's get into our meaty part, the science. As I mentioned last week, I have reviewed some of the clinical trials for Saxenda and semaglutide, which is Ozempic or Wegovy. So one of the questions that I had when I started this process was, what's going to happen when I get off this drug? Obviously, Saxenda reduces your appetite, and when you get off this drug, you would have your appetite back, and most people do eat more, and guess what? They gain weight. So let's review the science. In the last week's video, I used some of the data from the study, and basically these are diabetics, but we know now that people with diabetes type 2 and without lose weight at roughly the same pace on Saxenda. What this study had was a 56 trial period where somebody was getting Saxenda and then a 12-week follow-up period when they got off the drug. So at 56 weeks, as I reported, there was about 4% difference between those who had placebo versus Saxenda. And at the end of 68 weeks, that difference got cut in half to 2%. And I'm talking about the group of people that got the full dose Saxenda, which was 3 milligrams. This is obviously not good news. However, this is something that we need to know before we get off this drug and see the negative results, so we can prepare. We know from the scientific studies that exercise may not be very helpful for weight loss. However, it is usually considered very helpful for weight maintenance. So what happens with exercise is that exercise increases your appetite and you tend to eat more, or at least enough to compensate for the increase in exercise and whatever increase in metabolism that it produces. So while it is not going to help you lose weight, a lot of people find success in using exercise for weight maintenance. So my plan is to increase my exercise as I am coming off Saxenda. And because Saxenda gives me so much fatigue, hopefully I'm going to get more energy once I come off Saxenda, so I can exercise more. Another thing to note is, and this is important for me, I'm the kind of person that forgets about food and when I ate and what I ate and whether I'm going to be hungry or not, especially on Saxenda. This is kind of my Achilles heel, is that I tend to forget to eat, and then all of a sudden I find myself extremely hungry. So what I need to do is I need to plan my meals a little bit better and continue on the same schedule after I get off this medication. So that's my plan. Let me know what you think about it. For the next week, I am planning to review some of the studies that look at people who have lost weight naturally, so to speak, using exercise and diet, and see where the pitfalls of this approach are. I mean, weight loss is full of pitfalls. It's incredibly frustrating and difficult, and there are things that are happening in your body as you lose weight that sabotage that weight loss. So no matter how you're losing this weight, naturally or with the use of medication or something else, the results tend to be short-term. The only known intervention that produces long-term result is bariatric surgery. And while it's the gold standard, so to speak, this is not on the cards for me and hopefully not for you. So next week, I'm planning to go into the research around your natural body's resistance to weight loss. And of course, I'm going to report the results. So if you like this type of content, give it a thumbs up, subscribe if you would like to see where this medication takes me, and I will see you next week.